Let's talk about painkillers and anti-inflammatory drugs then, okay? So many of you have taken this one time or another. Some of you, unfortunately, are on long-term medication like this then, right? Now, we use this medication for acute and chronic painful conditions like inflammatory joint diseases, like arthritis, all right, pain, muscle pain, headaches, even migraine in some cases there. All right. Now, the commonest use drug here would be your acetaminophen or your paracetamol, right, or Panadol, which is a well-known brand name. So I mentioned earlier, right, the metabolite can cause liver damage, NAPQ1I there, all right, can cause damage to our liver cells there. And therefore, it's highly recommended that you avoid taking more than 8 tablets of paracetamol a day there, or more than 4 grams. Okay, that's the limit there. If you take any more than 4 grams a day for adults, it can cause liver damage there. It can potentially cause liver failure, right? In fact, in the past, even right now, people who want to commit suicide take excessive amounts of Panadol, paracetamol there. Now, I'm not giving you any idea, folks out there, so don't do this. Yeah, I'm just warning you against taking excessive amounts of paracetamol there. All right, if you must take maximum 8 a day, that's it, no more. All right, don't take for long term as well if possible. Okay, it's bad for your liver. All right, if you need to take often here and there, better do something about avoiding liver damage there, all right? Taking a supplement, for example. Now, the next class of drugs is NSAIDs, non-steroidal anti-inflammatory drugs there. This is commonly used in this class of drugs. It's like your ibuprofen, your aspirin, your diclofenac, or brand name naproxen, yeah? All right, that's okay. And there's COX-2 inhibitors, right? Like your COX here, your Celebrex. All these have been used as anti-inflammatories by the doctors there. Now, the common side effect is that it can cause gastrointestinal side effects like gastritis, inflammation of the lining of the stomach there, or it can even cause ulceration, right? This can cause bleeding, yeah, especially for those who are on long-term aspirin for cardiovascular disease there. Okay, I myself have seen quite a few patients with such a side effect there. So if any of you out there who's on aspirin today, because you need to thin the blood, okay, right? You got to check your stools regularly. If at any time your stools is black in color, bad news. Okay, you got to go straight to the emergency because black signifies that you have got bleeding in the upper GI tract. When there's bleeding in the upper GI tract, the blood, okay, is well changed to blackish color there, right? Because the stools become black and sticky. All right, so please go straight to the A&E department there. Okay. Now, the next side effect is kidney, can cause kidney damage. That's right. In fact, I've got a neighbor here who used to have bad gout and he uses quite a lot of painkillers, the anti-inflammatories in the past. And unfortunately, he developed kidney failure in his later years there, right? He's on kidney dialysis now there. So be very careful, all right? Don't use the NSAIDs frequently, all right? It can cause cardiovascular side effects. Heart muscle damage, can cause heart attacks, strokes there, okay? All right, certain these NSAIDs are linked to this cardiovascular side effects there, okay? The Rye syndrome basically affects people who are below 20 years old. It can cause liver damage and cerebral damage as well too there, all right? So avoid aspirin for people below 20 years old there, okay? So, of course, opioids, okay, usually reserved for the more severe pain, people on cancer drugs and all that, okay, who on cancer, we need to have strong painkillers. So, unfortunately, these opioids class can have all these neurological, respiratory, and gastrointestinal side effects as well too there. So, bear that in mind there, okay. All right, so for those of you out there who need to take something to reduce inflammation, I like to suggest some supplements which can be potentially of help there, all right? Instead of just taking all these anti-inflammatory drugs all the time, okay? So some of the supplements which I find helpful personally is curcumin, all right? Pycnogenol again, then the bromelain. okay? Then the omega-3 fish oil, yes, that's right, folks. Omega-3 fish oil has got anti-inflammatory effects. And then your vitamin D, all right? Vitamin D is known to have anti-inflammatory effects. If you're deficient in vitamin D, all right, your body tends to have high amount of inflammation there, all right? Your immune system tends to go down the hyper-inflammatory pathway there, all right? So make sure your vitamin D level is not in a deficient range there, all right? And for those of you who experience side effects, gastric side effects from taking all these painkillers, right, can take aloe vera. So curcumin, all right, curcumin is actually the active ingredient that comes from turmeric, the curry powder, right? All right, curcumin is known to be a powerful antioxidant. It's got strong anti-inflammatory side effects. It's able to reduce inflammatory markers, all right? And it's been shown to be beneficial to patients with osteoarthritis and rheumatoid arthritis, all right? It's got numerous other benefits as well. It's been shown to have anti-cancer side effects, improve cognitive health, lower blood sugar level, and insulin resistance as well. All right, so this is just a study that compares people on curcumin and this anti-inflammatory drug called diclofenac. Well, guess what? The group that was taking curcumin, okay, shows there's got higher improvement. Sorry, I must qualify first that this is studies which compares these two ingredients, curcumin and diclofenac, for the group of people with rheumatoid arthritis. Yeah, all right. So what they found is that the curcumin group, all right, those rheumatoid arthritis sufferers which were taking curcumin, shows a highest percentage in improvement in the overall disease active scores and the ACR scores there. All right, it's also significantly better than the group taking diclofenac. Right, and then more importantly, this group taking this curcumin, does not show any adverse events there. The curcumin is safe, in other words, there. Okay, so it's a no-brainer, isn't it? I would rather take something that is safe without adverse effect and equally effective as well. So curcumin can promote normal cell cycle. Curcumin can promote liver detoxification. All right. So you're on drugs, you take alcohol, or you're subjected to other toxins. Make sure, all right, you can take something which helps to improve your liver detox. Curcumin can also improve healthy levels of glutathione. Glutathione is found in every cell in your body. It's a master antioxidant found in every cell there. We want this to be high there, right? And curcumin can improve the glutathione level. So curcumin, unfortunately, has been shown to have poor bioavailability there, all right? You take curcumin, right? Not much of it is absorbed at all, that less than 5% there, all right? You take a lot of it, you just get a bad tummy upset. Well, guess what? This particular form of curcumin, the curcugreen, can deliver more bioactive curcumin there, all right? It can greatly enhance the absorption and bioavailability of curcumin. So that is why I tend to use this curcugreen there, all right? For my patients there, all right? For people with joint issues especially, okay? And this curcugreen is found in the curcumin extreme product there, okay? All right, yeah, this one there. All right, so I talk about pycnogenol. So pycnogenol, as I mentioned, is a natural plant extract from maritime pine trees. And what's so great about pycnogenol is that it can inhibit the inflammatory pathways here. Here we go. This is the one. It inhibits the COX-2 and the 5-LOX gene expression, inhibiting the COX-2 and 5-LOX inflammatory pathways in our body. So pycnogenol has been shown to reduce inflammation significantly there, okay? Various studies have shown that. It's been proven in clinical trials to improve osteoarthritis. It's been shown to reduce this NF-κB, all right? This is the mediator which switch on your pro-inflammatory pathway. So it reduces quite significantly. It also reduces the inflammatory pathway, the COX and the inflammatory pathway. It reduces cartilage degeneration enzymes there, all right, by more than 25%. It reduces CRP, the inflammatory marker, by more than 70%. That's huge. It reduces oxidative stress in your body by 30%. That's huge, isn't it there? Right? So after 3 months of taking pycnogenol, right, all these sufferers improve have their pain level reduced, stiffness reduced, joint function improved there, okay? So pteronidine also helps to stimulate collagen and hyaluronic synthesis, helps to rebuild the cartilage in the joints there. That's very important. So bromelain, I talked about it just now there, right? So bromelain is isotonic capable, right? Contains a combination of bromelain, white widow bark extract, and protease as well. It helps reduce inflammation and swelling there, all right? It helps the body natural healing process as well. I mentioned about aloe vera. Aloe vera helps the gut health too, all right? Aloe vera has been shown to have natural healing properties, helps to fight free radicals even, helps to promote healthy epithelial growth. That's important for our stomach and our intestine, isn't it there, all right? Okay, helps improve digestion, helps to buffer the acidity of GI tract as well. And I trawled through internet, right? And I found that the studies have shown that it can help to heal lining of the GI tract, balance the pH of GI tract, helps to reduce inflammation, helps in digestion, helps to improve bowel regularity, inhibit the growth of bad bacteria and fungus as well, promotes normal growth of good bacteria, right? And shown to be of some help for patients with all these gastrointestinal conditions there. All right, and I like to use this for my patient, the ultimate aloe there. All right, so ultimate aloe is derived from whole leaf, all right, and therefore retains the qualities of natural occurring aloe, right? The anthraquinones, the latex component of the whole leaf, significantly removed, all right. In fact, the amount that's left is really, really insignificant there, all right? So be very careful when you take aloe because we want the latex component, which contains the anthraquinones, to be removed there, right? And this particular product has it removed there, right? There's no natural, no artificial colors or flavors, right? And this is not preservative free. And more importantly, it carries this IASC seal, which stands for International Aloe Science Council. All right, this is a prestigious seal which is carried by very few aloe products there, because this seal certifies the purity and quality of the aloe content. All right, so you want to take aloe vera, make sure it carries this seal there. All right, this is the mark of confirmation of the quality and purity of the aloe product there. Okay? So you can take it in the juice form as it is here, or in the powder form in the easy to carry packaging there. All right. So let's talk